The Centers for Disease Control says approximately 1.7 million patients are treated for hospital-acquired infections each year, resulting in 99,000 deaths here in the U.S. The government says the infections and deaths are preventable. Those statistics don't surprise Cecilia McCullough.
I've heard of it, that have gone in and had one thing and then got something else in the hospital and got sick and passed away.
Hospital-acquired infections would include harmful bacteria or germs that you might encounter through injections, catheters, surgical tears, blood clots, or even broken hips. Hospitals that have too many of these incidents are penalized with up to a 1% reduction in their Medicare funds. Spring Hill Medical Center is one of the hospitals on the list.
It's maddening. It doesn't make sense.
President and CEO Jeff St. Clair says the hospital was penalized for the number of catheter-related urinary tract infections.
Like I said, 25 in a year out of 15,000 patients.
St. Clair says Medicare doesn't take into account the overall infection rate. In fact, St. Clair says the hospital has an excellent status from Blue Cross Blue Shield, which is the state's largest payer.
And then here comes CMS, who penalizes us for a very, very few infections related to one item, and that's the catheter-associated urinary tract infections.
The penalty for CMS, or Centers for Medicare and Medicaid Services, cost the hospital $250,000 a year.
Well, for us, it's a lot of money.
Both Spring Hill Medical Center in Mobile and Sacred Heart Hospital in Pensacola have been on Medicare's penalty list 2 years in a row. Rosemary Blackman is vice president of the Alabama Hospital Association in Montgomery. She says the penalties are actually making it harder for hospitals to keep you safe.
In Alabama, the last time we looked, 79% of our hospitals were operating in the red. So if you're already operating in the red, and then you have a 2 or 3% reduction of payments, which cover almost half of your patients, that can really wreak financial havoc on a hospital.
The government started penalizing for hospital-related conditions in 2014. 721 hospitals were on the list the first year. The number went up to 758 last year. Medicare also fines hospitals for excessive readmissions. These are patients who return for treatment within 30 days of their release from the hospital. The government says an excessive number of readmissions could indicate poor quality health care. Last year, 72 Alabama hospitals were penalized for readmissions. Almost every hospital in Mobile and Baldwin County and at least 2 in the Florida Panhandle are included on the Medicare website for penalties. According to Blackman, hospitals also take issue with the readmission penalty.
So you could be discharged for a heart procedure, that you did at the hospital, but then maybe you're in an automobile accident and you go back to that same hospital within that 30-day window. It still counts as a readmission. So there are also some things in terms of the readmission penalty that we really would like to see fixed.
If you have questions about the safety of any hospital in the country, Medicare also provides a website where you can compare facilities. You can see how a facility measures up to other hospitals in the area or the state and national average. Blackman says the government site is more reliable than other websites that seek to give hospitals a letter grade.
It's hard to look at a number of different measures and say, okay, well, they should get an A or they should get a B. It's much more complex than that.
We've posted a link to the Hospital Compare website on our website, fox10tv.com.